Hi, I'm U.S. Senator Rob Portman. I'd like to briefly talk to you about the coronavirus, otherwise known as COVID-19. Let me tell you what we do know about this outbreak. We know it started in China, and it hit that country hard. Other countries that have been hit particularly hard are South Korea, Japan, Iran, Italy. So it's a worldwide threat. Here in the United States, we've seen outbreaks too in a number of states, including here in Ohio, where we now have some confirmed cases. It's a serious issue. I'm working closely with the governor's office and the Ohio Department of Health to ensure that all Ohioans are getting the resources and the care they need, and to help keep the virus from spreading any further. At the federal level, I think we're fortunate to have a task force headed by the Vice President of the United States who can work across all the agencies to lead an all-of-government effort. There's also a coordinator for this effort, Dr. Birx, who, as the leader in the U.S. international response to HIV, has a lot of experience in responding to global health threats, is a real professional. Congress, as you may know, has acted already. We recently voted to spend $8.3 billion in federal funding to combat the virus. I've strongly supported that funding because I think it's necessary. Ohio will receive some of those resources to bolster our immediate public health response to it, and Ohio needs the help. These funds are also going to be used to support the development of a vaccine. That will be a while, but in the meantime, to help with regard to antiviral therapies, something like you have with the common flu, Tamiflu, to be able to help people who do contract the disease, but also to support the needs of our health providers in Ohio and around the country. Think about the hospitals and clinics and so on that are going to get a lot of patients if this continues to grow. However, there are steps we can all take to minimize the risk of catching or spreading this coronavirus. So continue to wash your hands. Use hand sanitizer if you don't have a sink. Avoid touching your face. Don't travel if you're a high-risk individual and don't otherwise have to. Avoid large crowds, any place where you could be closely in proximity with other people. As folks are saying, and the medical professionals are saying, keep some social distance as you're out and about. And if you're feeling sick, let a medical professional know. Most people who get the coronavirus are going to have flu-like symptoms. So a cough, a sore throat. And by the way, the vast majority of those people will make a full recovery. But older Americans and those with underlying health conditions should be extremely cautious because that's the group that seems to be the most vulnerable. So today, we can all do our part to make sure our communities stay safe during this uncertain time. I'm going to continue to work in partnership with Republicans, Democrats, everybody as Americans, with our governor, with our state and local health officials, to ensure that we have the resources in Ohio to be able to respond to this threat of the coronavirus. If you've got any questions at all, feel free to contact us through our website at portman.senate.gov or toll free at 1-800-205-6446. Thanks for listening and be safe.